Hello and welcome. So let's get started here. So let's look at what we are hoping to accomplish today. You can look at the session objectives. By the end of the session today, you should be able to describe the path forward for Mississippi's crisis response system, understand how the national crisis system principles align with our state services and reflect on guiding principles that support the strong continuum of care. We've specifically designed this session to be useful both for those of you who are joining us live right now and for others who will review the material later. So any insights that you share in the discussion and some of the polls we have will help guide where we focus those future and discussions. So I think that we are ready to jump into a poll. Is that absolutely correct, Rachel? Am I at the right? Yep. All right. You'll see the poll come on your screen. And we'd like to just get a reflection of where you feel, where we're starting from. It's just asking you to rank your current confidence in explaining Mississippi's crisis response system, including its history and how the components fit together. There are no right or wrong answers here. This is just a snapshot of how you're feeling right now. And we'll revisit this same question at the end of the session to see how your confidence or thought processes may have shifted a bit. Give everybody a little bit of time to respond to the poll. Looks like we have some confidence, unsures, some not confidence. At least we're being honest, very, very unconfident and no extremely so far. So that's pretty good. I'll go ahead and end the poll. And we'll revisit this again towards the end. So we'll pick back up with that towards the end of the session. So before we get into our content today, I'd like to introduce Director Wendy Bailey. Director Bailey currently serves as Executive Director of the Mississippi Department of Mental Health, a role she assumed in January of 2021. She began a career at the agency or with the agency in 2005 at the Mississippi State Hospital and has been with the department for 20 years. She is passionate about enhancing Mississippi's crisis continuum of care and expanding workforce development opportunities for those delivering crisis services. So, Dr. Bailey or Director Bailey, you have the floor.
Thank you very much. Looks like we've got a great group with us today joining us for our first training in this series, and we are so glad you're all with us. I appreciate the honesty on the poll as well, because I hope all of you who were unsure move at least one up to confident by the end of this presentation. So what I'm going to focus on is the road ahead. Basically strengthening our behavioral health crisis response system. Because in Mississippi, we are blessed that we have so many of the components there, but working on strengthening those and making those connections and making sure that everybody is aware of the resources is a focus of this. So next slide. We're going to start off by looking at the road that we've traveled. And if some of you attended our first in-person training where we kicked this off, you're going to recognize the majority of my section in this presentation. But for those of you who did not participate, we want to look at the road that we're on. The road to building a behavioral health crisis response system has not been a straight path in our state, but it has been one of steady progress, and it's been grounded in a commitment to expanding access, to building community-based care, and improving outcomes for families and people across our state. In the earlier years, Mississippi's system was very heavily reliant on institutional care, and there were very few community options available for people in a crisis. Mostly it was dependent upon a state hospital level of care or an inpatient private setting. But recognizing that there was a better path and a better road, the state, began to shift course and build a system that was rooted in accessibility and responsiveness and community capacity. And that's when crisis services became a central priority. So alongside this, DMH is focused on expanding housing, supported employment, long-term community supports to help people not only stabilize, but to thrive in the least restrictive environment possible. This work has been more about systems building, and it's been about creating choices, dignity, and hope for Mississippians. But there's still a lot of work ahead, but we're not where we started. So every mile that's been traveled has been a step closer to a responsive, person-centered crisis system that meets people where they are and walks with them towards recovery. So we're going to take just a brief history of some of the crisis service implementation so you can see where the system was and where it is now and what resources are there. Every day, the work that you do adds and builds to this system. It is constantly evolving and changing. So the first thing we're going to look at is crisis stabilization. Prior to 2011, DMH directly operated a handful of what we call crisis intervention centers that are now called crisis stabilization or crisis residential unit. Legislation allowed for a pilot program to move one of these crisis intervention centers to a community mental health center because they were previously operated under the state hospitals. The purpose for that was to move towards reducing the use of jails for people under civil commitment orders, and especially to offer voluntary commitment, because when it was under the state hospitals, you could only access a crisis unit through a civil commitment. So under this redesign, the pilot proved successful and additional CSUs were opened throughout the years. CSUs provide that stabilization and treatment services to people who are in a psychiatric crisis. They are all operated by community mental health centers. There are 14 now across the state with 204 beds that offer time-limited residential treatment services designed to serve people with severe mental health episodes that, if it's not addressed, would likely result in the need for inpatient state hospital level treatment. Next slide. Okay. Next, we're going to look at certified peer support specialist. Peer support specialists serve in an integral role throughout the crisis continuum of care. You are going to see peer support throughout this continuum. They are people who have lived experience, who provide support and guidance to others facing similar challenges. They help build community, offer empathy, and promote recovery through various methods like leading recovery groups, mentoring, goal setting, helping people create wellness recovery action plans, and so much more. The first CPSS class in Mississippi was held in 2012, and now the program has expanded. We now have certified peer support specialists that are trained specifically as parent caregivers, as youth and young adult, as forensics and recovery. So this is a person who self-identifies as a family member or a person who received or is currently receiving behavioral health services. Upon completion of the training and successfully passing the CPSS examinations and obtaining employment through a DMH certified provider, participants become certified peer support specialists. The training and certification process helps prepare CPSSs to promote hope, personal responsibility, empowerment, education, and self-determination in the communities in which they serve. They are a vital role in the system. Next slide. Crisis intervention teams. Crisis intervention teams are partnerships between law enforcement officers and a variety of agencies, including community mental health centers, also including those primary health providers and other behavioral health. In 2013, Mississippi implemented the Memphis CIT model and began outreach with law enforcement agencies across the state. We have come far with crisis intervention since 2013. Officers who've received crisis intervention team training respond to individuals experiencing a mental health crisis and divert them to an appropriate setting to provide treatment, ensuring that person's not arrested and taken to jail due to symptoms of their illness. This is a nationally recognized best practice, and officers who receive CIT training have been recognized as having the understanding and skills needed to resolve crisis situations. Multiple studies have shown that crisis intervention significantly reduces the instances of arrest and rearrest for people who have serious mental illness. Crisis intervention teams are partnerships between law enforcement officers and community mental health centers and other providers to have a full CIT team in your area. CIT training includes 40 hours of instruction and topics such as mental health diagnosis, medication, substance use issues, and more. One of the keys to this training is hands-on instruction in de-escalation techniques and hearing firsthand accounts from people who have experienced mental health crisis themselves and learning what resources are available right there in their own community. The goal of CIT is to respond to people experiencing a mental health crisis and divert them to an appropriate setting to provide treatment. Next slide. Mobile crisis. In 2014, each of the community mental health centers developed a mobile crisis response team to provide community-based crisis services in the location where an individual is experiencing a crisis. It's all in the name, mobile crisis response. These teams deliver solution-focused and recovery-oriented assessments and crisis stabilization services, but they work hand in hand with local law enforcement and chancery judges and clerks and the CSUs to promote that seamless process. And now they're working hand in hand with our 988 call centers in the state. The teams ensure a person has a follow-up appointment with their provider and monitor the individual until the appointment takes place. It's not supposed to just be an immediate response right then and there. It is also supposed to include that follow-up. These teams respond 24 hours a day, 7 days a week. Next slide. In 2019, the Federal Communications Commission, or the FCC, sent a report to Congress recommending the designation of 988 as a 3-digit dialing code to be used for nationwide suicide prevention and mental health crisis hotline. Before, this was simply named the National Suicide Prevention Hotline, and it was a long 1-800 number that someone needed to remember. So this was a major national move. The function for capacity for chat did not exist in our state very much, and that has been something that has been focused on across the nation and in Mississippi, is to build up the capacity to be able to do chat and text as well. Next slide. So 988 went live July 16th, 2022. The 988 Suicide and Crisis Lifeline provides that free and confidential, it can remain anonymous, emotional support to people in a suicidal crisis or emotional distress 24 hours a day, 7 days a week. The 988 Lifeline is comprised of a national network of over 200 local crisis centers across the nation, and they combine local care and resources with national standards and best practice. In our state, we have 2 988 call centers who do an incredible job. Next slide. House Bill 1222. House Bill 1222 was the Collaborative Response to Mental Health Act. It was signed by Mississippi's Governor Tate Reeves on March 22nd. It has numerous provisions related to mental health services, the Board of Mental Health, region commissions, and more. 2 that I want to briefly mention is that it requires law enforcement agencies in the state to have mental health first aid and CIT training for officers. And DMH is required to provide funding that was provided through the legislation to community mental health centers to designate court liaisons for service areas. And this helps improve diversion and connection to services in a crisis situation. Next slide. House Bill 1640. So this is the second piece of legislation that we've mentioned, which does show support from the Mississippi legislature to try to address mental health concerns in the state, especially related in crisis situations. House Bill 1640, prior to July 1st, 2024, the commitment process began by filing an affidavit with the Chancery Clerk, who would then issue a writ for a sheriff to take that individual into custody. As a result of House Bill 1640, the process now begins with a pre-screening. This new process puts the person first. It connects someone in need of mental health services with a mental health professional as the first step in the process, before the Chancery Court or law enforcement becomes involved. DMH believes the pre-screening process provides the family, and most importantly, the person in need of services, with community options by making sure they are connected with the local mental health authority first. Prior to this legislation, there was no law prohibiting the use of jail for a holding location for someone waiting for mental health treatment involved in a civil commitment process who had not broken the law. This law limits the use of jail to 24 hours and can only be used in rare circumstances. Next slide. So we talked about a little of these services down the road that we've traveled, and now I want to share just a little bit of data with you. Mississippi's crisis system is no longer an idea in progress. It is a movement in motion, and it is a movement in motion because of so many of you who are participating in this training today. The foundation has been laid, the infrastructure has been built, and now we're traveling a road paved with real progress, growing partnerships, and life-saving services. But there's still some potholes that we need to navigate. This part of the journey is about strengthening what we've built, making crisis care more responsive, more connected, and more accessible across every community in our state. From mobile crisis teams and peer support to crisis stabilization units and 988 implementation, the road we are on is leading us toward a system that meets people where they are and where they need it most. So let's look at a little bit of the data. 988 FY24 data. Nationwide, 988 received approximately 6.5 million engagements. Mississippi contracts with Contact the Crisis Line in Jackson and Contact Helpline in Columbus as the two call centers for the state. Our state is proud that we have one of the highest in-state answer rates in the nation last month, with 98% of the calls being routed to our two call centers in our state, where somebody from Mississippi is answering the call to provide that help. You can see here that texts and chats answered were 652, and this is still relatively new and up and coming. More than 15,400 calls were answered in our state in FY24 by the call centers, and that was a 14% increase from the previous year, FY23. And again, the overall in-state answer rate average for FY24 was 97%. Next slide. CIT. CIT, I mentioned earlier, Section 2 of House Bill 1222 requires each county or municipal law enforcement agency to employ at least one officer who is a trained crisis intervention team officer on or before July 1st, 2025. So we're down to just about 30 days for that deadline. It does allow agencies with fewer than 5 officers can contract with another agency to fulfill this requirement. You can see the numbers on the screen for FY24. There were 22 trainings held, 96 different agencies trained, 300 officers, and we've seen those numbers even increase in FY25. The last information that I received, there were 72, probably more than that now, out of 82 counties that now have at least one crisis intervention team trained officer, which is phenomenal for our state. Mental health first aid. Section 2 of House Bill 1222 also requires each county and municipal law enforcement agency to provide mental health first aid to all law enforcement officers by July 1st, 2031. It is an 8-hour training that teaches participants how to identify, understand, and respond to signs of mental illness and substance use disorders. It is not as intense as crisis intervention team training, which is a 40-hour training, but it does provide a tool for law enforcement officers' toolbox on how to respond. You can see the FY24 numbers there with 25 trainings held and 404 officers trained. And again, we've seen even more in the current fiscal year. Next slide. I mentioned peer support before, and I've got to touch on it again, just because it is so powerful and we want to see this enhanced in our state. The crisis system would not work effectively without people who are willing to serve as peer support specialists in every aspect of the continuum. In FY24, out of the 1,594 patients that were discharged from state hospitals to community mental health centers, 890 had a peer bridger meeting. And a peer bridger is a peer specialist who's trained specifically to bridge someone from a state hospital going back into the community with resources at their community mental health center. That's about 55–56% of all discharges. We want to see that number continue to grow. In addition to the state hospital patients who received those peer bridger meetings, there were over 200 clients at crisis stabilization units who had meetings with peer bridgers, making over 1,100 people in our state who participated in peer bridger meetings. Peer respite is another phenomenal program that's really up and coming. The Mental Health Association of South Mississippi and Gulfport opened a peer respite program in late 2024. This is the first in our state. It's a service that provides community-based, non-clinical crisis support during the day in a home-like environment. And these programs are currently training staff and they are working to enhance their services. Court liaisons, I mentioned that earlier with House Bill 1222, and the court liaison program aims to reduce the number of involuntary commitments to state hospital through diversion strategies and increase the awareness and usage of community-based services. All community mental health centers have at least one court liaison that's working with the local chancery clerk's office, with law enforcement, and with family and people in the community. Last fiscal year, the court liaisons conducted over 1,100 assessment interviews, and they diverted 654 people from placement under a writ or involuntary commitment. So that's a diversion rate of 58%, which is incredible. It also shows that with the right people making the right connections to resources in the community, you can avoid that highest level of care when possible. Next slide. Crisis stabilization units. We touched on that just a little bit as we looked at the road that we're traveling. And in FY24, as I mentioned, the state had 14 crisis stabilization units with 204 certified beds across the state. In addition to the adult CSUs, Region 9, Hines Behavioral Health Services, operates a child and adolescent crisis stabilization unit that's located on the grounds of Mississippi State Hospital. While it's operated by Region 9, it provides services to all 82 counties. Overall, for the crisis stabilization units, the average length of stay was about 13 days. There were more than 3,800 admissions, which was a 14% increase in admissions from the previous year. And they had a 93% diversion rate from the state hospital, which that means 93% of the people who walked through the doors of a crisis stabilization unit did not have to continue on to a state hospital. Mobile crisis response that we talked about, there were more than 7,800 calls made to mobile crisis response teams, and 35% of those resulted in a face-to-face response. The rest of those calls were able to be handled over the phone. About 43% of those face-to-face responses resulted in a higher level of care, but the individual was connected with the treatment that they needed. Next slide. Looking at the different people that are participating in this training today, and I hope you'll continue to participate in our trainings over the next year, what I see isn't just a collection of titles or roles or providers. It is the road ahead. Each of you, whether you're an advocate, a crisis worker, a peer support specialist, law enforcement, administrator, family member, partner, you are the ones that are building the path forward in this crisis continuum for our state. You're the ones answering the calls at 2 a.m. You're the ones searching for resources and making those connections. You are the ones de-escalating moments of fear, fighting for better policies, holding space for someone's darkest hour, and pushing systems to be more compassionate, more accessible, and more just. The truth is, we can have all the plans and all the fundings and all the best intentions, but without you, there's no movement. Without your lived experience and your commitment and your collaboration, there's no road forward. So when we talk about the future of crisis care in our state, we're not talking about something that's distant or abstract. We're talking about you. We're talking about your work, your heart, and your presence. Next slide. As we step into the rest of this training and the rest of the trainings over the next year, remember this. What we're doing here isn't just about programs or policies or protocols. It's about people. It's about making sure that no matter where someone lives in Mississippi, they can get the help that they need, when they need it, from someone who sees them as a human being, not just a crisis case. It's about sharpening our tools, strengthening our partnerships, and learning from each other, because no one does this work alone. Collaboration is how we build a system that not only responds, but restores, a system that heals. So let's train and let's talk and let's ask hard questions and share honest answers over the next year. Let's keep moving forward together because Mississippi deserves a crisis system that works. And you all are the people who are making that real. Thank you.
Thank you so much, Director Bailey. That was just an amazing start for us to learn about everything that Mississippi has done to get to where they're at. As Marilyn had said earlier, I am Jennifer Hodson, so I'll be taking you through the next little part. But to just orient us to the reason why we're doing this, we thought we would start with a little chatterfall. So if you could just enter into the chat one word that you believe best describes individuals who access Mississippi's crisis response system for help. Just one word, and we're going to let that chat populate while I move forward with the rest of our presentation today. But this is just to ground us in who we're really doing this for. Thank you. Next slide. So today we're going to talk a little bit more about SAMHSA, so that's Substance Abuse and Mental Health Services Administration's Crisis Care Continuum, its foundational principles, and then how it aligns with Mississippi's crisis response services. Next slide. So this graphic is really to illustrate the big picture of the crisis response system. So we're looking at best practices, and as you can see, it takes a well-coordinated system from every part working together, partners and stakeholders alike. So you have people doing the outreach, we have our hubs where we have our crisis call centers, our mobile crisis teams, our stabilization options, and then of course, as Director Billy talked about, those post-crisis community supports that really are going to help people to really build out support networks so that hopefully they will avoid re-entering the crisis phase. And it takes lots and lots of systems, as you'll see in the section below. Next slide. This just happened overnight as you learned about the road ahead. It has been a process with SAMHSA putting out its best practice guidelines in 2020 through all the legislation and advocacy that has had to happen to get to where we're at, and then the continued support through funding at the federal level, through passionate leaders like Director Bailey at the state level and her team, and all of you. So this is an ongoing process where we're building this crisis response system together. Next slide. So when we looked at the national guidelines, really SAMHSA puts forward three main ones. The first is someone to contact. So that would be services such as 988, the lifelines, other kinds of warm lines, peer operated warm lines, data and quality improvement. So, this is where we're really trying to look at when we call, what are the different places we call, and how do we know this is being helpful? The second step is somebody who responds. So these are services such as your mobile crisis teams, any additional outreach services, that really get to the most remote places in our state and how we solve to that, how we create equity in getting services out to all our populations that need it. So somebody responds. And then the last is a safe place for help. This is no barrier, low barrier crisis stabilization services. These can be referral based. These can be emergency crisis stabilization for youth on up. So making sure there's somebody that you can call, somebody who will respond, and then somebody that you can connect to for care. Oh, and on this slide, when you get the slides after the training, you can actually run your cursor over that image, and that will take you right to that document so that you can review it. Next slide. When we laid out the SAMHSA's foundational principles alongside Mississippi's foundational principles, you'll see that Mississippi lines up and goes a step further. So they also cover someone to talk to, someone to respond, somewhere to go, and the real important step is someone to follow up. So after, somebody has navigated the crisis response system, when they're working towards stabilization and rebuilding skills and rebuilding community, um, who are those people who can ensure that the connections are being made and that they're surrounded by what they need to move forward into that sustainable phase of health and well-being. Next slide. So we're going to have a couple of polls too at this point because we really want to continue to hear from you. So Rachel will fly those polls in for us. The first one that we'll ask you to fill out is, where is Mississippi strongest in its provision of care along the crisis care continuum? Hopefully, is that coming through yet? We might just be having some technical difficulties, and that's okay. It happens, right? Because when we're in a crisis, we know to pivot. So I would just like for each of you to think about this. Like, where would you say Mississippi is strongest? Would you say we're strongest in someone to talk to, someone to respond, somewhere to go, someone to follow up? And then where's the opportunity for our greatest growth in the state? Oh, here we go. Okay. You can plug in your answer. There you go. Here we go. Thank you. We always know there's things happening behind the scenes, right? We'll just give people a few seconds to fill this out. You're all doing great. All right. We're about to wind down here, but if you're still working on your answers, okay, we're going to move on. We end the poll. And the second one is, where along the crisis continuum do you think is the greatest opportunity for growth? So go ahead and use those 4 steps, those 4 categories, and let us know, where do you think in Mississippi we have the greatest potential for doing more, for developing more, putting more emphasis. Um, this is not about criticizing, this is about growing, investing, creating more opportunity for access. You can go ahead and enter in that as well. All right. Oh, there we go. Here it goes. And please note, all these polls today are designed to help us in the future trainings so that we know where to put more emphasis. It also helps with future planning, development of our crisis response system. So we're very grateful for your time in all of these polls because you represent such a wide variety of professionals and partners. All right, I'm gonna end the poll here. Thank you for your responses. All right, next slide. So I'm going to turn this over to my colleague Marilyn, who's going to talk with you a little bit more about Mississippi specific resources.
Thank you, Jennifer. And thank you for helping us understand that national framework and where the work fits in. And thank you, Director Bailey, for grounding us in the state's vision and the progress that Mississippi has already made. Building on the foundation, we want to take a look at the closer principles that guide how we approach the crisis care here in Mississippi. And I will say that, before I go into this a little bit, living in Mississippi, especially growing up here, it shapes how you see people, how you build trust, and how you show up for others. There's truly no place like it. And while our state is sometimes defined by its challenges, those of us who call Mississippi home also we know its strengths. We're a state rooted in relationships where people look out for one another. We lend a hand when it's needed, and we take pride in caring for our communities. So the spirit of our culture, it has to guide how we build and deliver services, especially our crisis services. Approaches that work elsewhere, they may not fit here. I mean, unless they reflect the values and connections that define our state. And we know from living here that, what works in Hinds County doesn't work in Madison County. What works in the northern part of the state may not work in the southern part of the state. You can have counties that are right close to each other, and what works in one doesn't work in the other. So these guiding principles that we'll talk about next are the foundation of our crisis continuum. So whether you're just learning about the system or this is a refresher, this section gives us a grounding that informs our approach, but the approach should be based on our reality of who we are and how we care for one another, and especially knowing how we do that in our state. So we can stay on this slide right here. So this graphic gives us a statewide view of how Mississippi's crisis system is organized. It mirrors the SAMHSA model, but reflects the Mississippi structure and operational priorities, which are important for our state. It's important to mirror, the national model, but also have things that are very specific that work in our state. That alignment helps us take advantage of national investments, technical assistance, while ensuring the local fit is there. So the framework includes, like Jennifer discussed earlier, someone to talk to, someone to respond, somewhere to go, and someone to follow up. And we'll go into these a little bit more. Next slide. So the first is someone to talk to. This includes points like the 988 crisis line and other mental health crisis support hotlines. Jennifer also gave some examples of those earlier. Mississippi launched 988 in 2022 and has made meaningful investments in public awareness, particularly through outreach, youth, schools, caregivers, etc. The outreach has helped connect people with services in moments of need while reducing the stigma around reaching out for help. So in states like ours where relationships matter, we know that there are trusted people in our communities, schools, churches, community leaders, and they play a key role in helping people feel safe in making that first call. And so the goal is to ensure everyone in crisis can reach a trained responder, no matter where they are, and receive the support they need in a timely, respectful, and culturally appropriate manner. Next slide. Someone to respond to. Mississippi's Mobile Crisis Response Team operating across 15 mental health regions. These teams are multidisciplinary. I think you can hit enter one more time. These teams are multidisciplinary and provide rapid in-person support in the community, whether it's at someone's home, school, workplace, a familiar setting. The goal is to meet people where they are and reduce the unnecessary involvement of law enforcement or emergency rooms and provide help in a way that helps people feel safe and supported. These teams are a critical part of the system, but like all things grounded in community, must be trusted, well coordinated, and available when they're needed most. So as you look at the regional map, take a moment to reflect on your area. Think about what's already working well. Where might we need to strengthen capacity, awareness, or response times? Just think about those things and keep those in the back of your mind. Next, we have somewhere to go. So Mississippi offers multiple levels of care for individuals who need more, support during a crisis. These include crisis stabilization units, acute psychiatric hospitals, peer-run respite or diversion centers. These services are available across regions and play a critical role in safely stabilizing individuals and connecting them to care. One goal is to not only de-escalate the immediate crisis, but to do so in a way that is person-centered, respectful, and grounded in the realities of the communities where we are or where they live. These settings also help reduce unnecessary involvement of law enforcement, like I said before. And sometimes it's 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 the people who are trained to be more equipped to provide the kind of support that some people need. So as we continue to expand access, ensuring that these services are welcoming and responsive to Mississippians a priority, we want you to think about the additional peer-led options. We may not have full visibility on those, so if you know of one or two, feel free to mention it in the chat at a point or follow up with Director Bailey and her team on those. Next slide. All right, someone to follow up. So follow-up care is probably a part of the most critical, and it's one of the most often overlooked pieces of the crisis continuum. It helps prevent future crisis and helps people connected. It makes people feel more connected to hope and healing. It lets people know they've been seen, heard, and valued. So in Mississippi, this support comes through community mental health centers, like Director Bailey said before, the peer support, certified specialists who check in after crisis, help people re-engage with services, and walk alongside them in their recovery. So these are not often one-time interactions. They're built on relationships, trust, understanding values that run deep in that community or that state. And that kind of follow-up reflects Mississippi's growing commitment to continuity of care, the person-centered support, and making sure that nobody has to navigate it alone. And I think at this point, I'll turn it back over to Jennifer.
That's great. Thank you,
Yeah,
Marilyn.
you're
Well,
welcome.
really, the true presenters for the remainder of this are going to be the people in attendance. So they just didn't know it yet. Everybody's sweating. Very easy. But the first is another Chatterfall. So thank you so much for the words, the meaningful words that you put in. I tried to go in and acknowledge everybody. But you're absolutely amazing individuals for what you do and for being able to see and serve the people that you do. In this Chatterfall, we want to make sure that we have not omitted any resources, any formal resources along that continuum in Mississippi that we should really be mentioning as we move forward in these trainings. So if you did not see a service or a resource or hear of one, please put that in the chat, and we're going to keep a tab on those things so that we can try to incorporate them into some evergreen documents that we're going to be creating for you. All right, continue to do that while we move to the next slide. So I told you I was going to give you some work to do. So here's another opportunity. My colleague Rachel is going to be putting up a poll. And what we would like for you to do is to really rank for us so we can prepare for future meetings, just kind of your level of confidence in successfully assisting any of these groups of individuals who might access Mississippi's crisis response system. So each might have unique needs, and we just want to know what that level of confidence is. And if you can rank that for us, that would be great. And we're going to give you a few seconds to do that. What we're hoping to do is in the trainings over the course of the year is any of the groups that it looks like people are really wanting to know more about in specific, that we with intentionality will be bringing them more into the trainings. Now we will have some that are specific on some of these populations, so we still wanted to just get a sense of your level of comfort. But there are others that I think we just want to make sure we're bringing in effectively. So we appreciate what you're doing to draw them in to your thought process right now. Great, you're all doing very well. We're going to give this just a little more time because this is we know you got to get through each of those letters and it's really important. And so the key for it is at the bottom, but we'll see that you're extremely confident, very confident, confident, unsure, not confident, very confident. So, or very unconfident. Okay, we've got about 36 of 89. So we're going to just give you a little more time here. And Marilyn did a beautiful job of outlining how every county can be different. Every community within a county can be different in Mississippi. And so being able to prepare our responders to serve the needs of a very diverse group of people across the state is really important. You all are doing very well. So we'll just give another second. All right, we're going to close this in about a minute. And for those of you who might be accessing this training after, we really encourage you to just put your own thoughts into this and your own level of comfort in how you're thinking and feeling about all these different populations that you have the privilege of serving and where your level of comfort is. I've trained behavioral health providers for over 25 years, and we're always in a state of growth and professional development. So sometimes groups and communities move into our area, and it's an opportunity for us to learn more about how we can adjust our services to make sure that we're providing care to everybody who needs it. So I think this is something that as a community of crisis responders and caregivers and care providers that will continue to grow and change as our populations grow and change across the state. Okay, good job. We'll do a little bit more. I'm going to go ahead and end the poll. Looks like we've settled in. Okay, and you can just look for a second and see where everybody's feeling the more confident and less confident. Um, so absolutely, I appreciate all of these responses. This is really going to help inform. And please know your state leadership will also be getting this as well. So they will also be reflecting and thinking about these findings. All right, and then this is a poll, obviously, for future trainings. So we will definitely be sharing this with you in the future. Okay, so for the next slide, now, Director Bailey had said at the beginning that she was really hopeful that at the end of this presentation, hopefully feeling a little bit more confident in understanding Mississippi's crisis response system, particularly its history, the main components of it, and how those components can potentially function collaboratively. So we will have the whole year to continue to immerse in really nuanced parts of our system, but just wanted to see where people were at. And I wrote down the numbers. So I can already see the percentages have gone up in confidence, which is really what we were hoping for. Um, this is great. So, and we will continue to check in with you throughout the course of the year to see that that is increasing as you become more and more informed and you learn more from your leaders and your services and your community partners across the state. So this is fantastic. We'll give just a little more time. I think we're slowing down. And we still have a couple people who are not confident, and that's absolutely understandable. And that's why we're here and what we're doing, so that we can help ensure that we get there. And we're going to give you, once this poll closes, I will show you where we're going to be having some additional training so you can see those topics and hopefully that will help. All right, we're going to go ahead and end the poll. All right, thank you so much, Rachel. All right, the next slide. We do have a list of references. So when you get a copy of the slide deck, you can go through and you can see the different ways that you can link all of the resources that are at your disposal. You can share these with your teams, can review them yourself. So there's quite a few things that really cover that whole continuum of crisis response that Maryland went through for the state of Mississippi. So we wanted to make sure you had that. And the one, as far as the Mississippi schools, that is a relatively new resource. So that would be a really great one if you're working with youth and children, but it also has some really helpful tools and nuggets in there for working with people across the lifespan, but it is particularly designed for schools, and I was really impressed by that product. Okay, next slide. So the upcoming trainings, we have quite a few. The next one is best practice of mobile crisis response. So that will be coming up at the end of June. You should be getting a registration for that. That is done by, we have some national experts, so we're very, very excited about that. We also then have trainings on elevating the voices of peers and advocacy groups. That is another one that is really important. And as you've heard, especially at the connect part of this, but throughout the crisis response process, we have law enforcement, safety and care planning development, best practices in hiring mobile crisis response teams, suicide and homicide risk assessment, safety protocols, crisis response specific to the needs of Mississippi's communities, crisis care approaches for supporting veterans, client-centered mobile crisis response and care, responding to adolescents and youth in crisis. We have supporting persons with co-occurring disorders and serving persons who are homeless or at risk of being homeless. We will have a website, the state of Mississippi, so the Department of Mental Health. We want you to check that frequently because they are going to be putting updates about the trainings there. They're also going to be uploading the recordings so that you can watch them for future or send them to others on your teams, but they'll be there for future reference. Okay, next slide. And that is all for today. So we really do want to thank you for joining us. And I do want to thank my colleagues, for Director Bailey for all that she's putting into this. And we're really hoping to see you all. We recognize that you have very busy schedules and you're doing amazing work. So we're really thankful that you're here today. Director Bailey, did you want to say anything else to close?
No, thank you. We had right at about 90 participants today, which is phenomenal for our first training. So please share this information with others and we're going to get the message out. And again, as we move forward, like Jennifer said, you're going to get more trainings on specific populations and issues that we hear from you that are concerns. So we appreciate your feedback and your input and thank you for participating today.